Hello students, in today's video we are going to discuss syphilis. Syphilis is a sexually transmitted disease. We will study causative agent, mode of transmission, pathogenesis or the stages of syphilis, its treatment and prevention. We will also discuss congenital syphilis. Now, syphilis is a bacterial infection caused by a gram-negative spiral-shaped bacterium Treponema pallidum. Now, syphilis is very effectively treated with the antibiotic penicillin G. But if it is not treated, it can cause serious and potentially life-threatening complications including damage to the brain, heart, eyes and nervous system. So let's first understand how syphilis is transmitted. Now, syphilis is most commonly transmitted through vaginal, oral or anal sex with an infected partner. Now, infection also spreads vertically. It is transmitted from infected mother to her child during pregnancy or during the childbirth. Now, syphilis in fetus or in a newborn baby is known as congenital syphilis. Now, congenital syphilis is a very severe, disabling and often life-threatening infection. Now, rarely syphilis is transmitted by infected blood transfusion and also due to sharing of contaminated needles contaminated with Treponema pallidum. Sometimes it also spreads non-sexually due to contact with the skin lesions of syphilis, as these lesions contain the bacteria Treponema pallidum. Another very important thing, syphilis is not transmitted by the use of public toilets or by sharing food or by a mosquito bite or by cough or sneeze. Now, during pathogenesis of syphilis, the bacterial infection develops in stages, namely primary syphilis, secondary syphilis, latent syphilis and tertiary syphilis. Now, each stage has its different signs and symptoms, and syphilis is most infectious during the first two stages, that is during the primary syphilis and secondary syphilis. Now, syphilis should be treated as soon as possible, otherwise it develops serious complications. Now, first-line therapy for the treatment of syphilis is the antibiotic penicillin G. Now, let's understand prevention of syphilis. Now, the best way to prevent syphilis is to practice safe sex. Now, infection is reduced by the use of condoms, but the infection is not completely prevented, as contact with the infected lesions spread the disease. However, early diagnosis and proper and complete treatment of syphilis cures the disease. Now, after prevention, let's discuss pathogenesis or the stages of syphilis. Now, if syphilis is left untreated, bacterial infection progresses into 4 successive clinical stages: primary, secondary, latent and tertiary syphilis. Now, primary, secondary and tertiary stages are symptomatic. They show symptoms, while latent syphilis is asymptomatic. It does not show symptoms. Now, incubation period of Treponema pallidum is around 21 days. So, symptoms of syphilis appear in around 3 to 4 weeks after the bacterial infection. Now, the first stage is known as primary syphilis. Now, primary syphilis is a localized infection, and here the infection does not spread throughout the body. The infection remains localized. Now, in primary syphilis, usually one, sometimes or we can say rarely, a few localized painless lesion or sore or small wound is seen in the genital, like as you can see here, the small lesion on the penis. Now, these lesions can be seen in the cervix, anus, rectum, and also on the lips and also in the mouth. Now, this lesion is called as chancre, and this lesion, it heals on its own within 3 to 6 weeks. So now, very important, in most of the cases only one lesion is produced, and that too painless, and further it heals on its own within 3 to 6 weeks. So this lesion of primary syphilis, that is chancre, it gets unnoticed, and usually patient does not bother about the treatment, and primary syphilis progresses to secondary syphilis. Now, in addition to this, another symptom of primary syphilis is the regional or localized lymphadenopathy, that is swelling of the lymph node. Most commonly, enlargement of the inguinal node, that is the lymph node in the groin, due to the bacterial infection. So, this is the primary syphilis. So, if primary syphilis is not treated, the bacteria from the lymph node are passed into the blood, and now the infection becomes systemic and it spreads to different parts of the body. Now, after healing of chancre or few weeks after the healing of chancre, symptoms of secondary syphilis appear. Now, one of the main symptoms is the appearance of widely spread or widely scattered and on a very large area disseminated maculopapular rashes. Now, these are macular, that is flat, or papular, that is raised rashes. So, these rashes can either be flat or they can be raised. Now, these rashes are usually reddish brown in color, and they appear in very large number on a wide area, especially on the palms of the hands, then soles of the feet, and also on the entire trunk, that is on the chest as well as on the back. Now, these rashes, they do not cause itching and they heal on their own in weeks to months. Now, in addition to these maculopapular rashes, condylomata lata, another type of sores, another type of wart-like painless sores. These sores are the small growth of the skin. These are seen in the genital area and in the mouth. And these painless sores, they also heal on their own. Now, systemic spread of infection can cause generalized lymphadenopathy, and other symptoms can be, because of the infection, fever, fatigue, headache, myalgia, that is muscle pain, then sore throat, and loss of hair can cause patchy alopecia. So, as you can see here, the symptoms, they resolve on their own without treatment within few weeks to months, and moreover the symptoms, they are not painful, and there is no itching in the rashes. So, most of the time patient avoid treatment. Now, if not treated, secondary syphilis is followed by asymptomatic latent syphilis. No symptoms are seen. Now, this latent syphilis can last for years to decades. So, if not treated, in around 75% of the cases, this latent asymptomatic phase can remain lifelong, while in around 25% of the cases, latent syphilis progresses to tertiary syphilis. And tertiary syphilis is very destructive, and tertiary syphilis produces life-threatening complications. So, as discussed, latent syphilis is asymptomatic, no symptoms are seen, but the patients test positive for the syphilis. Now, this latent syphilis can be of two types. early latent syphilis and late latent syphilis. Now, early latent syphilis is the syphilis where infection occurred in the past 1 year. But if the infection occurred more than 1 year ago, then in that case it is termed as late latent syphilis. So 25% patients of latent syphilis develop tertiary syphilis, and complications of tertiary syphilis can be life threatening. Now, most important symptom of tertiary syphilis is the appearance of gummas. Gummas are granulomatous lesions that can appear on the skin, bone, liver, heart, brain, testes, and these gummas they produce irreversible organ damage. In cardiovascular syphilis, gummas can cause otitis, that is inflammation of the wall of aorta. Aorta, as we know, is the largest artery of the body. Now, injury to the wall of aorta causes enlargement or excessive dilation of aorta at several places, which is termed as aortic aneurysm. And this aneurysm can cause rupture of aorta. And rupture of aorta is obviously life-threatening. Then gummas in the brain cause neurosyphilis, and this neurosyphilis can cause meningitis, that is inflammation of the covering of the brain, seizures, stroke, sleep disorder, dementia, that is impairment of memory, hearing loss, vision loss. And neurosyphilis can also lead to Argyll-Robertson pupil, where the pupil of eye stop responding to light. Then Tabes dorsalis, where the dorsal column of spinal cord is slowly damaged, and it results in broad-based ataxia, where the patient is unable to stand with feet together, or the patient is unable to walk properly. And it also causes dysesthesia, that is painful, unpleasant sensation when the patient is touched due to the damage to peripheral nerves. So, tertiary syphilis produces life-threatening complications. So, this is the pathophysiology or the stages of syphilis characterized by primary, secondary, latent and tertiary syphilis. Now, it's very difficult to identify syphilis because the first and the second stage of syphilis usually go unnoticed, while gummas of tertiary syphilis resemble granulomatous lesions of tuberculosis and few other diseases. So, now let's discuss the diagnosis of syphilis. So, now let's understand how syphilis is identified. That is the diagnosis of syphilis. Now, direct field microscopy. Now, this test is the most specific test for the diagnosis of primary syphilis. Now, here the pathogen or the bacteria is identified in the lesion, that is in the chancre. So, serum is collected from the chancre, and this serum is observed for the presence of Treponema pallidum. So, this method is the most specific method for the diagnosis of syphilis in the primary stage. Now, due to short exposure of bacteria, antibodies against the bacteria are not produced in the blood, and therefore serological test cannot be performed for the diagnosis of primary syphilis. Then serology, that is serological tests are performed for secondary, latent and tertiary syphilis. Now, these serological tests, they detect antibodies in the blood, antibodies against the pathogen. Now these tests, they can be non-treponemal screening test or they can be treponemal confirmatory tests. Now, non-treponemal tests are only screening tests as they detect antibodies directed against treponemas but not specifically against Treponema pallidum, while treponemal tests are confirmatory tests as they detect antibodies specifically against Treponema pallidum. Now, non-treponemal screening tests include VDRL test, then RPR test. Now, VDRL test, it is the Venereal Disease Research Laboratory test. Now, this VDRL test is not very specific for syphilis. This test can be positive in other diseases also, like in the case of lupus it is found to be positive, in leprosy it is positive. So, these are not the confirmatory test, these are the screening test. Now, treponemal confirmatory tests are the FTA-ABS, that is the fluorescent treponemal antibody absorption, then TPPA, that is the treponema pallidum particle agglutination assay. So, these are the non-treponemal screening test and treponemal confirmatory test that are performed during secondary, tertiary and latent syphilis. Now, in neurosyphilis, lumbar puncture is performed, and by this cerebrospinal fluid or CFS is extracted or obtained, and then serological tests are performed on the CSF. So, these are the tests that are performed for the diagnosis of syphilis. Now, screening as well as confirmatory test both are performed for the complete sure diagnosis of syphilis. So, after diagnosis, let's understand treatment of syphilis. Now, syphilis is very easy to get cured during the early stages, and penicillin G is the first line therapy for the treatment of syphilis. Now, primary, secondary and early latent syphilis are effectively treated with a single dose of intramuscular benzathine penicillin G. Now, if patient is allergic to penicillin G, alternate regimen is to treat the patient with doxycycline for 14 days. Now, doxycycline is contraindicated in pregnant women. Now, tertiary or late latent syphilis is also treated with intramuscular benzathine penicillin G. But penicillin G, that is the benzathine penicillin G, is administered here once weekly for 3 consecutive weeks. Now, a patient allergic to penicillin G can be treated with doxycycline for 4 weeks. But doxycycline is not to be given to pregnant women. Then neurosyphilis, ocular syphilis or otosyphilis, these are treated with intravenous penicillin G for 10 to 14 days. Now, within 24 hours of antibiotic treatment, patient may experience Jarisch-Herxheimer reaction. Now, this reaction is characterized by fever, chills, headache, nausea and pain. Now, this reaction subsides in around 24 hours. Now, as antibiotic treatment kills bacteria Treponema pallidum, these bacteria release toxins, and the toxins released by the bacteria produce this reaction. So, monitoring by the healthcare team is required during the Jarisch-Herxheimer reaction. So, this is in general information on the treatment of syphilis. Now, for the actual treatment of patient, for the actual treatment of syphilis, consult your physician. Now, self-treatment of syphilis is not advised. So, now let's study congenital syphilis. Now, congenital syphilis is a severe, disabling and often life-threatening infection seen in infants whose mother were infected with syphilis and were not adequately treated. Now, congenital syphilis is caused by vertical transmission, that is transmission of syphilis from infected mother to child during pregnancy or during the childbirth. So, during pregnancy, the infection is transmitted via the placenta, while during the childbirth, the infection is transmitted when the child comes in contact with the lesions of syphilis. So, let's now study symptoms and complications of congenital syphilis. Now, during pregnancy, that is in utero syphilis, that is transmission of syphilis to fetus during pregnancy can cause miscarriage, that is abortion, stillbirth, that is dead baby is born, then hydrops fetalis, that is building up of excessive fluid in the tissues and organs of the fetus, and preterm birth, that is birth before time. So in most of the cases, either the fetus dies in the womb itself or the baby can also die after the birth. Otherwise, if infection is transmitted during childbirth, most neonates born with congenital syphilis are found to be asymptomatic at the time of birth. But if the symptoms appear in child less than or younger than 2 years old, then syphilis is called as early onset syphilis. Now, symptoms of early onset syphilis are hepatosplenomegaly, that is enlarged liver and spleen. Now, liver damage can cause jaundice. Then rhinorrhea, that is runny nose with snuffles, that is discharge from the nose loaded with treponema pallidum. Then maculopapular rashes, as was seen in the secondary syphilis on the palms, on the soles and also on the trunk. Then skeletal abnormalities like osteochondritis, that is inflammation of bone as well as cartilage. Then periostitis, that is inflammation of periosteum, that is the covering of the bone. So this produces abnormalities of the bones and cartilage. The bones and cartilage, they become very weak. Then generalized non-tender lymphadenopathy due to systemic bacterial infection. Then meningitis, that is inflammation of the covering of the meninges of the brain. So these are the highly disabling and life-threatening symptoms of syphilis which are seen during the early onset syphilis. Now, if the symptoms of syphilis appear in child older than 2 years of age, then in that case it is known as late onset syphilis. Symptoms are typical facial features of the face change, like for example the nasal cartilage or the nose bridge is damaged, it is destroyed. So the nose becomes deformed and this nose is called as a saddle nose. Then forehead becomes abnormally prominent and it is known as frontal bossing. Then very prominent maxilla, that is the upper jaw, also develops abnormality. Then Schaberschen, it is a deformity of tibia, that is tibia is the front bone of the lower leg. There is bending of the tibia. Then Hutchinson's triad, this is also a characteristic feature of congenital syphilis. It is a combination of 3 abnormalities. Now the 3 abnormalities are Hutchinson notched permanent teeth, that is abnormal teeth. The permanent teeth, they become abnormal with a V-shaped cut in the center of the tooth. Then sensory neural hearing loss, that is the hearing loss due to the damage of nerves, damage to the nerves from ear to the brain. So those nerves, they get damaged and that causes the hearing loss. Then interstitial keratitis, that is inflammation of the corneal tissue of the eye, and this inflammation of the cornea results in corneal scarring and cause blindness. Then appearance of genital, anal and oral gummas, that is the granulomatous lesions as was seen during the tertiary syphilis. Then neurosyphilis can also cause intellectual disability in the child. So overall this congenital syphilis is a severe and a life-threatening infection. Now adequate treatment of mother or the adequate treatment of maternal syphilis with penicillin can prevent the congenital syphilis. So this is all about syphilis, a complete overview. Please note, this information provided in this video is only for the informative general awareness purpose, only for the academic purpose. Now, if you wish to treat syphilis, consult your physician. If you find the video useful, kindly like, subscribe and share this video. Thanks for watching this video.